And looks like we're live. Dr. Africano, are you there?
Yeah, right here.
All right. Looks like we're working. We're live. It is Antonio with New Grad Optometry and Covalent Careers. Welcome if you're joining us. And I'm excited to be here today with Dr. Robert Africano. Dr. Africano is part of the National Vision Doctor of Optometry Network through employment with North Carolina Primary Vision Care Associates, an independent medical practice with multiple locations within America's Best contacts and eyeglasses stores in North Carolina. Dr. Africano is a 2015 grad of Salus University and completed an ocular disease primary care residency at the Eye Institute of Salus University. So we've got a lot of good stuff planned here to talk about today. And I personally have never worked in corporate optometry myself, but you know, there's so many different brands and modalities within the corporate model, more than I think optometrists and optometry students really understand. We certainly weren't taught the differences in school, I can tell you that. But the important thing to understand, I think, is that your career and your experience within all these different types of modalities can really vary dramatically depending on where you work. So today, Dr. Africano is going to share his story with us and answer your questions and just give us insight into an average day in the life. So if you have questions during the broadcast, feel free to ask away. There's a live chat there. You can just type them in. I'll be keeping an eye on it. Dr. Africano will just interrupt you when necessary. If you're joining us over on your lunch break out on the West Coast, or if you're joining us between patients here on the East Coast, if you do need to cut out early at any time, don't worry. The broadcast will be made available on New Grad Optometry after the event, as well as on our YouTube channel. So why don't we jump into it, Dr. Africano? Why don't you just, you know, give us a little bit of your background, you know, your story and how you got to be where you're at right now.
Absolutely, absolutely. First of all, thank you so much for having me. You know, I'm really excited to talk with you, Antonio, and talk with anyone who's really interested in, you know, kind of what I do and kind of my setting, because I do think it's good to know everything that's available and all the different modalities and what options are really going to work best for you, for your lifestyle. Myself, so Antonio, you said I'm a 2015 Salus grad. I was really excited. I stayed another year and did a primary care residency with the Eye Institute, you know, through PCO and Salus, of course. Really great time. I really built a wealth of knowledge, a lot of comfort with kind of patient care and kind of the process. And that, of course, was in, you know, the Northeast. After that, my life took me a little bit further south. I'm in North Carolina now. Upon that move, I came down to, you know, North Carolina Primary Vision Care Associates. In my first year, I worked alongside in the clinical advisory panel, which I'm sure we'll talk about in a little bit about that. And now this year, I'm actually university ambassador for Salus. So I'm really excited. I've been kind of world move and kind of going through this kind of change of modality. And I think it's been all really great things. I'm really happy to kind of talk about it with everybody.
Yeah, wonderful. You know, you, like you said, you chose to, you know, continue your education, do a residency. You know, what was your primary motivation for doing residency? I mean, what kind of prompted you to do that?
That's an excellent question. I typically have really bad answers for any questions like that. I'm like, oh, you know, it's kind of what I kind of just fell into. But the residency is something I personally felt really strongly about. And when I graduated, you know, everyone's just a little bit nervous. You know, they're comfortable enough with what they're doing. But personally, I always felt like I wanted to be the best of whatever I'm doing. I want to be the best possible. Kind of present myself the best and can perform the best I could. And I thought with a residency, I can really kind of, you know, polish my edges, make myself feel more comfortable with some different pathologies, with patient care and the process. And I knew a residency would really help that. I was really excited to stay with the Eye Institute and the Pennsylvania College of Optometry and their program through Salus, because I knew the patient population, I knew the faculty, and I don't want to be biased, but of course, you know, Salus has the best faculty around through a lot of, you know, excellent competition out there. But
like Sydney, right?
Oh, yeah, right, yeah, close.
Yeah, like Sydney, of course. Yeah.
But you know, I mean, on a good year, who knows? But you
Right,
know, so I
right.
was really excited to stick around and learn and kind of grasp as much knowledge that I could from these great minds, and kind of work with the patient population. And I thought, and I think I hopefully was correct with that assumption, that I really became the best possible doctor I could through that residency. And it really guided me, made me the doc I am today. And you know, on almost a daily basis, I reflect back on either a patient or something I learned, or something I learned from my colleagues and my co-residents, at least on a day-to-day basis today. So I really do kind of touch back on that, you know, in doing what I'm doing now. And I'm really happy that I did that in the past. I personally feel like I made the right decision for me. I know a lot of people aren't interested in residencies at all. I know a lot of people who are kind of on the fence. Personally, I think if you're on the fence about doing a residency, go for it. Because, you know, I know often they say if you don't do it initially right out of school, you won't. I actually had a co-resident that left. I forget how long she was out for, but I know she came back into the residency. And, you know, that is obviously an opportunity and availability out there for some people. But I think the likelihood diminishes, you know, each year you're out of school.
Yeah.
So if you want to do it, go for it. I would strongly recommend it.
Yeah, definitely. So, you know, you do your residency, you've got this wealth of knowledge now, and you go to start your career, and, you know, you find yourself working in, you know, a corporate setting now. Did you think this was going to be your career pathway during your residency or before your residency, maybe when you were in school? And, you know, how did you kind of arrive there? Is this kind of what you had in mind? Is this kind of, did you just make this decision to pursue this modality? When exactly did you decide this?
That's an excellent question, and no, and not in a bad way, no. But I had my, you know, as a, you know, a freshman coming into, you know, Salis, I knew exactly what I was going to do, and I was going to, you know, open up a private practice. You know, it evolves, and I'll give you the whole evolution. You know, initially I came in, I'm going to do a private. I want to be a doc. I want to be an owner. I want to be, you know, a salesman. I want to, you know, advertise and go into marketing, all with my practice. And I wanted to take, you know, this huge weight, you know, on my shoulders. And that's what I wanted to do. And, you know, you're young, you kind of grow through the kind of your schooling and your career. And, you know, the great thing is you get to kind of observe. And you know, as a student and, you know, as a doctor, once you get out, you really want to observe your surroundings, observe all different modalities and what's out there. And then like that process changed over time. And then I was like, you know, maybe I'll work at a practice and have the opportunity to buy in if I wanted to. And then I'm like, yeah, maybe I'll do the ODMD thing. Maybe I'll go into this, that, or the other thing. And I really looked around, and I still probably wasn't really considering corporate yet, because I honestly didn't know what opportunities were out there and really what the corporate setting was all about, or some of the corporate settings were about. But I'll tell you the story, and I know I wanted to talk about this at one point, so we'll talk about it now. What really kind of guided me away from the private practice, and this isn't a bad thing, you know. Obviously, private practice works; they're out there and they're doing great. But I would say, you know, each modality isn't for everyone. And I won't name names, but I had a colleague. They opened up a private practice, and we're working along in another practice as well. And she was just really going through a lot of stress. You know, she was at the other practice working, and she's telling me how she's thinking about the, you know, her new cold open. She's worried about the, you know, the patient coming in, bouncing back and forth. You know, she'd go to lunch and go straight there and see a patient. I saw she was incredibly, I'm going to stress the word stressed. Yeah. And, you know, and I know there's some risk and such involved opening, you know, a practice cold. And I was going, oh my gosh, I go, is this what I want to do? I go, I go, you know, I don't know if I can deal with this right now. And so it really kind of opened my eyes into, obviously this isn't going to be the situation for everyone. And I know you're going to be in the red initially. You know, those first couple of years are tough. It's all an uphill battle. But once you get to that hill, you know, you start doing well, you build the patient population, and it's, you know, there's a lot to benefit from after that. And that's obviously, you know, there's that initial battle. But I'm like, you know what, I don't really want to do that right now. So I'm like, maybe this isn't the thing at this time in my life. So then, you know, I finished my residency, and I guess I was a little bit of a procrastinator with it, because I know probably at least 2/3 of my residents, about like 4 months before we concluded our residency, they, you know, had jobs lined up and they knew exactly what they were doing. And I'm like, I don't have a clue. And also, I knew I was moving. So I knew I was going from, at this point, I was in Philadelphia. My family was in New York. And I'm going down to North Carolina. I go, I don't know the types of practices there. I don't really have too many friends in the business there.
Yeah.
I don't know where I'm going to live. I go, how am I supposed to find the job?
So what brought you to North Carolina? I mean, they've got pretty tough board exam from what I understand.
They do, yeah. It's one of the toughest around, absolutely. I do have some family down here that made that venture. I think my brother came down probably about 15 years ago, and I have some other family down here as well. And in kind of as I grew up and I saw kind of the way of life down here in comparison to New York, the housing prices, things along those lines. And then on top of it, I saw how well optometrists can do in the area once they can get kind of past those boards. I'm like, this just seems like a really good fit to kind of be the next step in my life, to raise a family. We got that one. I have one on the way coming in November, so that's
congratulations.
Thank you. So this is what it's always really about for me, kind of making this move, kind of I cultivated, but now I'm going to plant the roots and really kind of grow the family, kind of go career-wise, make those moves. And like I said, I knew how well optometrists can do down here. So that's what kind of prompted the move, along with my family kind of making that journey as well. So I thought that was nice. So like I said, so I'm stranded in the Northeast, having no idea what I'm going to do for my next step. And so I spoke with luckily some more tenured docs and some smarter people than I, and they said, get in touch with some recruiters. So I put my resume out there. I contacted some recruiters to kind of look into some things for me. And amazing enough, I found my current position, just going through my emails, and I open, the iHire Optometry. I'm like, oh, this sounds interesting. I go, why don't I contact them and see what kind of information? Mind you, at this point, I had
right?
Exactly.
Yeah.
It's just, and that's actually a great point. When you're looking for a job, and you have all your options open and get the information. And I think probably when I was a student, I was a little bit closed-minded, and I wanted to do this, that, and this, and everything else, forget about it. It's not an option. But it's really good to really get all the information that's out there on everything, just so you know what you could be doing, what others are doing, and how that all works, and how those webs kind of align there. So I contacted the recruiter. I'm trying to think. Yeah. So I said, at this point, I was staying at my mother-in-law's, and because I think we already had the house sold, so I contacted them just to get some information. And she I always say that she painted this picture, and I was like, my jaw dropped. I was like, no, that doesn't make any sense. She was talking about kind of the compensation, the vacation, and benefits, and everything. I'm like, this sounds like a pretty good deal. I'm glad I got this information. But somewhat, I'm someone that really I like to have my ducks in a row and kind of know exactly what the situation is. So I of course inquired, could we do an office visit? I go, I'm not down there right now, but in a couple of weeks I'm going to be down. Let's take a look at the office, look at the location, talk with some of the doctors, and maybe get a little bit better feel for what the office is about. And mind you, at this time, I had actually no idea what the office was. America's Best. I had no idea that they were affiliated with National Vision. I had no idea. All I know was pretty much the bones of the operation.
So you were pretty much interviewing them almost in a way.
Oh, I had pages. I had pages of questions. And I think that's a good thing when you're looking at, know what you want to know what you're interested in. And it was tough for me because I had no background in knowing that. I was, it was wonderful about working in academia is they pretty much take care of everything for you. And, work with the students, train them, teach them everything that you can, and you'll see the patients and do the best thing you can for them. And we'll take care of everything else, which was really nice. But I was kind of sheltered, so I didn't know what to look for in the private sector. So I asked everything. I had I got all the information there, and I don't want to cut you off. I don't know if you want to talk about anything else right now, Antonio, but.
Oh, no, continue. Yeah, no,
okay.
This is leading up to basically you starting your career. So this is the history of how you got to where you're at, which is, important for us to know. And, we'll get to your first day on the job after you kind of made your decision. So I don't know if there were certain things that, basically made you say, yes, this is for me. And maybe we will talk about those a little bit later. But
Sure,
at some point, you decided this is what I want to do, right?
Absolutely, and I think it's a great segue. And then so we came down, we made the move. And I don't think we had furniture yet. I think we were in the house, and I think we were on the folding chairs, and we were like eating on the floor and on the countertops. And I came to do the practice, the visit, and like I said, I pulled up and I'm like, oh, okay, it's America's Best location. I didn't know that. And being completely open-minded, I looked at this is the information that they gave me. This is the location. Does it matter if it's corporate? And at this point, I go, let's see what they have to say. So I walked through the office, and at that point, I met one of the doctors that works for the company. Ironically, it's my area doctor, who's kind of like the mentor for the doctors in my North Carolina, Charlotte area, and kind of a little bit actually extended into the North Carolina. And I met with him, and he guided me around, showed me the office, introduced me to some of the staff, showed me some of the equipment that we have in the stores. At this store, we have the FDT and the retinal photography and things along those lines, but they don't have the automated phoropters. And some of the other locations in North Carolina we do. I hate to say that, actually I think I'm a little bit old school. I like the traditional phoropter.
Me too.
Just when you have that high sill, I think it's a little bit easier to play around with. But that's where the trend is going to the automated. I do like those as well. So I don't want to badmouth those, but it's a little bit different. So he walked me around and told me a little bit more about the company. And once again, it's kind of painting this, complete picture. We had kind of the layout, some of the this sketching of it, and then when I talked with the recruiter, she painted a little bit more of the image, and then I think it was just making things a little bit more concrete when I was talking with the area doctor and that location. He told me a little bit more about the compensation, benefits, and things along those lines. He also mentioned, and I said I'll probably talk about this a little bit more, about like the onboarding process. They have a mentorship meeting after in the company for a few months. And then there's the annual CE, which was just kind of icing on the cake at that point. And I was like, okay, great. And so he, of course, inquired if I had any questions. We discussed a little bit more, and I told him, I'm going to go home and discuss with my family, my wife, and we'll kind of see if this is going to work for me in my lifestyle. Yeah.
Was there anything that surprised you on your initial walkthrough that you weren't expecting, or maybe later on, once you started working and stuff, maybe there was other things, but on that first day, is there anything walking through the office that you saw that you didn't expect to see? Maybe it was all the technology and that kind of thing. I don't know.
Well, I think that's a great question. I think that initial walkthrough was not starstruck, but just kind of just between being in that new environment and not kind of knowing what to expect. I was kind of blind by a lot of stuff.
Sure.
I think the retinal photography was interesting. I didn't know that they were doing that. That was interesting. It was a fun thing to have. That's always something that's great to have some baseline, some further documentation for your patient care. I'll tell you, I think the biggest thing, and maybe I'll talk about it now and rather than a little bit later when that first day. But I think the biggest thing, which is kind of probably a little silly, is that I was really hung up on not typically operating an OCT. And I was like, and I've had this conversation. I had this conversation with the previous residency director at the Eye Institute. Great guy, and we would like to kind of discuss kind of what was going on in the world of optometry. And we were talking about OCTs, and I like to be a pragmatic guy, so I like to look at both sides and kind of look how it benefits. And of course, the OCTs are a great technology, and it's great to utilize in your practice. And it's such a fun tool to have. But I always feel like you look at something like I'm not sure OCT. That little speck of pigment. OCT.
Yeah, for sure.
2015 minus OCT. So, and I was like, are we, not maybe as a group or, personally, sometimes we use it as a little bit of a crutch. But, and of course, obviously it's so useful. It's so many times, but sometimes maybe we're just doing it when it's not necessary. And so we were doing it for so many people. And I'm like, oh my God, how am I going to practice without an OCT? This is berserk. And then, so I'll kind of fast forward a little bit, and you get used to it. You start to truly identify things. You know what CSME is? It's clinically significant. You're supposed to be identifying it on fundus evaluation, not via OCT.
It's funny. It's funny you're sharing this story because I think that when you get out of school, you kind of have that same idea, because when you're in school, you have access to everything. And when I got out of school, I was filling in here, filling in there, going to different practices, I realized, man, a lot of practices, they don't have OCTs. They don't even have fundus cameras. I've practiced in a spot that didn't even have. They had a phoropter, but it was one of those old school phoropters where you actually had to manually move the JCC. Yeah, I'm talking like, so when you get out there, you're like, things are different, but so ultimately you decide to go in and you accept your offer and you start working, and it's your first day on the job. So what was your first day on the job like?
So the first thing, what's really nice with National Vision affiliated offices, and with my practice, is that they have an onboarding process. And the kind of the old kind of like homage that when you need to teach a child to swim, you throw them in the deep end. And I think in a lot of practices, and I think I'm not very experienced in all the modalities, but I think maybe some of the other corporate modalities are like this, that bam, first day, here's a full schedule of patients, go see them. And you're expected. You're a professional. You're trained. You're a graduated doctor. You have the training and the knowledge to do it, but that could be scary. For me, in my practice, it wasn't like that. We have the onboarding process. It's a 3-day process where it's pretty much an orientation and introduction to the office, to the practice itself, and to pretty much the whole kind of the structure of what you're going to be doing, who you're going to be working for, and how you're going to be working. So which was great. So you're really kind of just dipping your feet in on those first couple of days and kind of working with it. Typically day one, you're going to be shadowing the first half of the day. You do some paperwork. Once again, you do a little bit of a tour of the office again, because of course you forgot from that office visit. You kind of learn a little bit about the computers, about the documentation, things along those lines. And then what you do is you shadow the doctor that you're working with, and that's the area doctor. So once again, I with my area doctor, and was kind of seeing how he functions on an appropriate schedule, how he's working with patients, how he's increasing efficiency and doing things along those lines. You kind of pass back some conversation on how what he's doing, how he's doing, and why he's doing it like that. I don't refract like that. I wouldn't do this like this way or that way. And you kind of reflect and see how to really increase efficiency and not cut things out, but just perform and work efficiently, of course. And then, the roles reversed after lunch. You start seeing patients and the area doctors observing you. And then once again, you discuss kind of efficiency and kind of ease the flow and things along those lines.
So they really ease you into it, is what it sounds like.
Yeah, which is really nice. And, I think that can be, I'm a creature of habit. So when I go into a new location, no matter what, if it's almost identical or if it's very different, I like that kind of that gradual process. And what I think it's really good if you're a new grad, I think that's very advantageous that, you're kind of eased into the whole process of seeing patients, working in a new setting, working with new equipment, working in a new office, getting to know the staff around. It's a really nice process, and I think it's a really smart move. But there's also a little bit of variability with it. So by day 3, I went, hey, Dr. Cohen, I go, I'm good. I go, not that I don't mind you over my shoulder, but I'm ready to see some patients. I really want to feel what the actual flow is going to be like. He said, of course, I'm going to be right here if you need me. So I'm seeing patients, and I'm trying to pull up these photos, and I can't get, hey, doc, can you take a peek at this? I'm working with a multifocal contact lens. And, one of the things about academia, which it's absolutely excellent environment, but particularly I didn't have all that much experience with some contact lens wear.
Right.
So I bring him in. I'm like, I have this multifocal patient. This is what I want to do. It's been a couple months since I fit a lens like this. What do you think? And you bounce some ideas back and forth, you get some feedback, and I go right back in there and finish what I need to do. And it was really nice to have that support, have that that someone to kind of talk with and make some decisions. just to kind of a little bit of guidance to kind of help me along the way, to kind of get me into the deep end, so to speak.
A little mentorship in a way. That's very valuable when you first start getting out there on your own. So fast forward to today. What is your average day really like? When do you start in the morning? How many patients you're typically seeing? What type of encounters do you usually have? I think that a lot of times people, at least from talking with different students throughout the day, that's a large part of what I do here at Covalent Careers and New Grad Optometry. I talk to a lot of students, and they say, well, I feel like if I go the corporate route, or if I practice in a corporate setting, I'm just going to be refracting all day. You know what I mean? So what is your average day like today?
Good. All right. So that's great. So I'm sure I'm going to miss some of the things you discussed. I really want to hit on everything because they're all great factors. So let's just start from the beginning, and we'll kind of work our way kind of towards the end there. So I love my day because I get in at 9:30. Some people that might be a little bit late for me. I hated those 8 a.m. patients. I wasn't quite just there yet to kind of be working with. Oh my gosh, we have an odd day. I can't do this at 8 a.m. So I come in a little bit later. We start at 9:30. We end at 6:30. So I go in, typically I'll walk in, I'll come in about 10-15 minutes early. I'll talk with reception, get any correspondence that I had from outside docs. Typically they're already on my desk in the doctor's office, so I can just pop in back there. I'll review everything that I need, kind of all the paperwork for the day. If there really is anything, typically I'll get 2 or 3 referrals back and get some information on a patient, either glaucoma, cataract surgery, retinal specialty, things along those lines. So I'll take a look at that and then get everything refiled. And by that time, I'm walking into the exam room. And everything's set up. My technicians, wipe everything down. They get everything prepared for me, so a patient can be in my chair and I can get right to work. But of course, I'll walk in, make sure I'm very anal about having that 90 lens, kind of pristine, my 20 all set, ready to go, placed exactly so I can grab it when I need to.
Of course.
And then so I'll peek out, and typically the first patient's worked up for my technician. I love having the technicians, the right-hand guy or gal, kind of help get things moving, get you working efficiently, and get everything flowing. I'm sure we'll talk about that in a little bit. And like I said, that patient's ready. I'm bringing them back, and I'm working up, and that keeps a steady flow. Typically, there's rarely a time where I need to pop my head out and kind of see what's going on, if there's a problem, if there's a delay. But of course, the technicians really are aware that if there's a problem with the flow or they're having issues with the patients, they'll come to you to kind of get things working. And I'm having trouble with this patient. Same thing, reminiscent when I had, when I was working with students, which was so awesome. I really loved that experience. That kind of keep things going and kind of keep the hiccups out. Get out back, finish the last half of the day, and which is really nice is when I get that last patient and I drop off the chart. I'll check with my technicians, and there's no one's back here, right? Check with reception, everyone's in, and I clock out and walk out. And I don't have to close up shop. I don't have to worry about, billing for the day. I don't have to worry about, getting the merchandise back up on the walls and make sure that everything's ready for the next day, because my, the rest of the staff's gonna get that all taken care of. So when I leave and when I walk in the next day, everything's ready to go again. And I think that's probably the only, there's consistency in that, but otherwise every day is going to be a new wild journey considering our patient population. Is there anything in regards to just kind of the flow of the day, anything else you wanted to touch on there?
Yeah, no. So, I mean, it sounds, just like a pretty normal average flow for most practices, patients worked up, patients in the exam room. Doesn't sound like you actually really need to do much of that process at all yourself. So you can focus primarily on just doing the exam, seeing the patient. So you have the patient in your chair and you do your exam. What kind of patients are you usually seeing? Is it all refraction? Is it disease? I mean, tell us a little bit about that.
That's where the fun part comes. And the thing is, so I'm going to kind of preface it by just, I think really depending, that question comes up with students a lot. They always want to know, what are you seeing? Are you actually seeing disease? Are you doing a lot of refraction? And that's a big question. And that's an important one. Personally, I think you're going to see everything everywhere. But And I didn't even think about this. I was talking with, I forget when, I was talking with a colleague, and they work right outside of a university. And they say, and they work on a private practice, and do you know what I see all day? I see -1 and 2 myopes. I see early presbyopia. That's what I do all day. And it has no reason and no weight, depending on what modality he's in. It's just the fact that that's where his practice is and that's what his patient population is. So I think a lot of that question, which is typically a loaded question, depends on what area you're practicing in. The type of modality, I'm sure, can vary that and kind of change that, the volume and the type of patients that are coming in, dependent refractive or, pathology. But I think it's mainly based on your location. What I see is I have a great kind of mix of patient population. I see too much disease. I'm going to give it to some of the new grads. They can have it.
Yeah.
But I really,
I see. Give me that 2 diopter myo, please.
Yeah. Oh my gosh. I'm like, oh, just please. I'm like, another 4 diopters a still, another 7 diopters a still. I'm like, nah. But really, no, I do see a really nice mix. I do have some of those easier refractions coming in, and I think I'm working with it so efficiently through them that I'm just seeing so much more of the disease. You're seeing the whole plethora, which was really nice with our last CE meeting. Is they did a poster section where everyone kind of had, if they had a cool case, they worked it up, and then we had some posters made, and there were probably like 50 or 60 posters of all the kind of cool pathology that everyone sees. But personally, I see a lot of retina, I see a lot of corneal pathology, a lot of systemic issues. Was it so? Was it? Yes, no. It was 2 days ago. I had a patient come in as a TPA, which is pretty much our emergencies. And he came in. He had a sudden loss of vision, of course, 2 weeks ago. And I look undilated. I'm like, okay, he's got a vit heme. So I go, well, what's causing this? So I get him dilated. He's got this really large inferior horseshoe tear. And like I said, it doesn't matter what modality you're in. This gentleman's going to come in to be it private practice or our practice. A lot of times we may see some of these patients, rather than maybe the private practices, is because of insurance based. We may see a good deal more of uninsured patients. And sometimes, they don't realize when they come in for an emergency exam, particularly, that a lot of times this is going to be medical rather than vision. So they're like, oh no, I have medical insurance. I'm like, okay, good. You wouldn't need to set you with a retinal specialist. But you will see maybe sometimes a little more of this pathology because of uninsured patients. But like I said, that's going to vary, of course. But like I said, I really see a rich plethora of disease and refractive cases. I'll tell you one thing. I actually see a lot more cornea stuff than I saw when I was a resident and when I was a student, particularly corneal ulcers. Mm-hmm. I think actually probably as a resident, I really had a rich experience and saw a lot of great stuff, a lot of interesting stuff and scary stuff. But I didn't have that many corneal ulcers. I maybe had like 2, maybe 3. And I think within my first month, I probably had at least 3. Like sometimes I can see 3 a day on account of a bad day for the patients, of course. So, you see, and the nice thing about that is that's something, you're going to see in any modality, and you want to be able to identify it, treat it promptly. These patients are in a lot of pain. They need proper care to kind of reduce scar formation. And actually, I had a patient that I really didn't want to keep because she's a young girl, and she wasn't a typical contact lens abuser, and she had a large central ulcer. And I went to, this isn't something I would normally keep. And if I was guess what? If I was a resident, this was going to corneal specialty at that time. So it didn't matter the modality or the practice type. And I'm like, I really would rather you be with a corneal specialist, because I go, at this point, I would really want a culture. I go, we don't want this to go south at all because we're going to be losing vision. And she was unsure. And she goes, I really cannot afford to go to anyone else right now. So I said, of course, okay, I'm reasonable. I go, let's give it a couple days. Let's see if we can get this improving. And I go, if it can improve, then we'll keep it here, and I'll treat it to completion. Thank goodness, we saw some significant improvement. She lost maybe a letter on the chart, and maybe if that, and she was in perfect 20/20 after we had this fully resolved. And this was the scariest ulcer I've ever seen. And if that was in, a year ago, or actually 2 years ago now, when I was at the Eye Institute, I would have been shivering because I'm like, I have not seen anything like this, So, bring in all the cornea docs in, I'm out. Let's get this
a lot of disease, it sounds like you see a lot of disease, you treat manage a lot of disease, which, I feel like is something that a lot of people wouldn't, expect or think of, So your residency really is helping you. It continues to help.
Oh, absolutely. Like I said, I probably reminisce and kind of utilize residency training like if almost probably daily, I would suggest. And and that correlates to both refractive and pathology, of course. It's you're gonna have that experience and that involvement. What's really nice about a residency is you're gonna see a high concentration of crazy stuff. The big thing is when you're out there, if you do a residency, if you're working 10 years, you're gonna see a lot of stuff. You're gonna become more comfortable. And it's just when you see it that first time, that's when you step back. You gasp and like, oh my gosh, what do I do again? And of course, the first time you see it, you need to run and open up your wills and, kind of go through the process, and you do that. But what's nice about residencies, you see a lot of that stuff. So when you see it the second time, you see it the third time and fourth time, you're more comfortable. You can treat the patient quicker, become more efficient, and that helps the patient flow. And of course, it's mutually beneficial for pretty much everyone.
Yeah. What's your schedule typically like? I mean, do you, in terms of just, how many patients might you see? What time do you go home? That kind of thing.
So I'll preface this by saying one of the other reasons why I wanted to do a corporate setting is, I don't know if this is accurate, but I had a real big hang up that I was slow. I was not moving as fast as I wanted to. This is even like in comparison like to student rate. I was like, I know I have to be moving fast to actually see the patients, put food on my table and get them out so they can actually eat the food on their table. So I typically say there's a big gambit, a range. I probably see from 20 to 30 a day. It's a very steady flow for me. I maintain, I get out on time. When I get out late, it's typically not because of my schedule. It's because my last patient of the day has pathology, or I need to spend some extra time with them. You know what takes the most time rather than pathology or weird refractive cases is dry eye. And I think all the doctors out there know that it's simple, but it's so complicated, and you really need to properly educate your patients with this. And I'm a dry eye sufferer, so I know. And, I tell them, this is what you need to do. This is what you're not going to do. This is what I need you to do. So that's like my typical volume. Like I said, it's very easily maintained, but like I said, it's daunting, initially. Which is nice is with the onboarding. Actually, one thing I didn't mention is after the onboarding, you don't go straight to a full schedule. They'll have a reduced schedule for you, and you kind of gradually increase that schedule. And they kind of monitor and make sure that you're getting out on time, that you're doing well with it, that you're comfortable with it. So you don't go from day 3 to, oh my gosh, day 4. It's kind of that gradual process getting you to a normal patient flow. Sure. And they work with you. And like I said, if you have trouble with the patient flow, your area doctor is there for you. They'll once again talk about efficiency and how to improve things, and maybe how change this to kind of make things a little bit quicker and a little bit more efficient for you.
Yeah, I mean, all in all, it sounds like a pretty average day, I think, for most ODs, in really any setting. I mean, when I was working at the private office, we have big group practice, but average day for me was 20 to 30 as well. So that sounds pretty average, pretty typical. And of course, some of those are follow-up, some of them are pathology, some are just contact checks here and there. A lot of comp exams too, but I guess, a lot of it too is about the support staff, the support you get. So, I know that having the patient there ready for you with everything already, entered in maybe, or, the instruments ready for you to roll definitely allows you to do that. And it's nice because it keeps the day moving too.
Absolutely. And I'm very lucky with the support staff that kind of help keep me going. I'll start with the kind of the front of the house back, kind of talking about that. I don't want to leave anyone out. But so all this, at least my practice will have a general manager. And they're just there just for that, to keep the flow, make sure that they keep you moving, keep the patients going, make sure that the technicians are doing what they should be doing. Make sure that the reception is getting people through, make sure that patients are happy, make sure that the sales associates up front are doing things appropriately and get the patients what they need. Let's say I'm out of tropicamide, my general manager will order me any my equipment or new drops that I need. They'll also, of course, let's say I'm having any issues with any, I need some repairs on some of my equipment. She'll get that taken care of as well. She'll put those work orders in, and it's amazing. We'll put a work order in, and I'll have a technician coming in to fix my slit lamp, and a day or two to get everything working, which is always really nice. And also nice it's not coming in my pocket too. You need to get some equipment either replaced or fixed.
Yeah.
So
Always nice.
Yeah. I'm like, oh,
the more that can stay in your pocket, the better, right?
Absolutely. I'm like, oh, I can live with my slit lamp just sliding off the table. This isn't affecting my patient's, my pacing or anything. So they'll handle all of that. Let's work our way back a little bit. Of course, we have the receptionist, and I think the reception here for my practice isn't going to work like any other receptionist. Kind of helping, with patient flow once again, of course, helping with all my prior auths. Once again, kind of correspondence back and forth between outside ODs or MDs. And the big thing is, I'm a cautious doc. I do like to have some additional testing with a lot of things. And let's say I just need a patient that needs an OCT. That's the only thing I need from them. I have some doctors in my area that I'll say, hey, I just need some additional testing. Can you get the information back to me directly so I can continue my care? So we can do that. And it's almost like a level of co-management if necessary. But let's say, of course, I need a specialist, get all that paperwork back and forth so we can keep that correspondence so I can know what's going on with my patients and can make sure that they're in the right hands, getting things moving. And of course, my receptionist getting that book going, and I don't have to worry about that. I don't have to worry about if I have a couple of patients on the book or a full book. We'll make sure that it all gets taken care of day by day and as the day goes on, which is nice. And then maybe the most important for me is, the optometric technicians that are working across the whole. And like I said, I really love it because it reminds me of when I was working with students. And what's so great about so many of our technicians is they want to learn, about the practice and about what we're doing and what they're seeing. So they do such a great job of getting all the pre-testing work done and getting everything ready so that that patient can sit in my chair and I can get moving and so continue with the history and pick up from where they left off and get into all my additional tests, which is just so great. And of course, let's say you have some, custom things that you want them to do, or different doctors want them to do a test this way or that way. They're always open to make those changes and kind of make us happy with kind of our relationship, getting things done perfectly and getting things done efficiently. Actually, what's really nice is I was just observing one of my technicians to make sure that everything was working great. And I left out, okay, you're doing a great job. Let's just make this little tweak here. And then she comes to me, she's like, can we do this more often? She goes, I really want your feedback so we can get the patients getting the testing that they need done, get things done efficiently. And I'm like, yeah, absolutely. I don't want to make you too nervous, but I think that'll be good for everyone.
Yeah, sure. One thing that comes up a lot, especially when you first graduate, is what kind of role do you have in the optical? Because I know that one thing that's challenging for especially new graduates to learn is doctor-driven dispensing. And in many cases, for those who go on to work in private practices, or obviously if you own your own practice, your compensation oftentimes is directly tied to the success of the optical. So do you have to play a role at all in the optical? I mean, what's your role there? Do you have no role?
No, I don't have to worry about a dime that we sell, which is great. And I think I used this term in the article. I don't remember, but what I like to call it's unadulterated medicine, unadulterated kind of optometry. Yeah, I don't have to worry about anything other than what I'm doing in the exam room, and other than kind of anything out on the outside with to do with my patient's health. So I'll do my refraction, I'll do my ocular health assessment, and then I'll tell my patient these are my recommendations. And a lot of times this is what I'll say. I'll go, I'll give you 3 factors to when you go out there and get your glasses. I go, and they're going to of course suggest the things that we discussed, but I want you to kind of work within your economic means. I want you to think about your day-to-day life. And I want you to be happy with whatever you're purchasing. I go, that's really what we need to do. And a lot of times, we hear so often, and I know it's just not me, I know it's a lot of doctors within the network, that you hear a patient coming, this is the first time I've been able to afford glasses in X amount of years. And, I just feel worse and worse the bigger that X is. And, it's often, 4 or 5, but we have 10, 15, 20, 25. Oh, when I was in high school, when I was in grammar school, I'm like, oh my gosh, we need to get you seeing again and get you living life to your fullest, potential. And if they need a progressive lens, and if I really think it's going to help them, particularly because of computer work, I'll make those suggestions. But a lot of times, let's do DVO and NVO. Let's do, if they're a low myope, let's a low hyperope, let's do an intermediate, a computer range, and let's get you some things that you can work on in your documents. A lot of them, I love to read, and I look at that prescription, I'm like, I know you can't read comfortably, in my head, of course. And I'm like, we need to get you doing what you love. I go, this is what we're here for. And I'm really happy that we can facilitate this with so many patients that otherwise wouldn't be able to get care or would have to delay it even further. And another thing is, you bring in these patients that need care because they can afford it, and then once again, you're catching pathology that would otherwise go unnoticed for X more years. So it's really great that we can help this population that needs it so much, or the dollar smart consumer that just doesn't want to spend an arm and a leg, or wants to spend a little bit less. It's there for a lot of people, and we're always really happy to kind of facilitate that.
Yeah, so it sounds like you get to really focus on just the exam and doing what's best for the patient. I mean, there's nothing better than that. It really isn't.
No, absolutely. Yeah.
And previously, because I want to talk about opportunities for growth. So I feel like one thing that I hear a lot of times is that, well, I don't know about a corporate career for me because I don't know. I think that I'll be limited in what I can do. I'll just be seeing patients and that's it. There's really nothing else for me out there. But you kind of mentioned this a little bit earlier. You've had many opportunities throughout your career thus far to get involved in other forms of opportunities. So why don't you tell us a little bit about that and how that came to be?
Absolutely. Actually, before I jump into that too, I'm going to touch on one other thing about the previous question about kind of being involved in the optical. That's also for the docs that can also be a lot of fun too, because I know, like I said, one thing when initially, I would have loved to be in marketing and selling and kind of working with every kind of layer of your practice. That has a huge advantage too. If you want to kind of have that type of lifestyle too, that is something that you can do, and there's nothing wrong with that. And you can always get the best for your patient. But there's both sides of that coin. I just don't want to be too biased with that because I'm not involved with the optical. But in regards to the additional opportunities. Through my practice, like I said, my first year, I think within 6 months, I was just having a discussion with my district manager, and she brought up some of the other opportunities that were available. I'm like, oh my gosh, I had no idea that there were other things that we can do within the company and do within the practice. And the first thing I was involved in is with the clinical advisory panel, which I think was really a really great group and a great thing to do for the doctors in the company and in the network. Because what the clinical advisory panel does is, let's say we're considering bringing in new products, new contact lenses. When they did the retinal cameras, when they first rolled them out, before they rolled them out, it went through the clinical advisory panel. I think it's about 10 or so doctors of kind of varied tenures. I was with the company under a year when I joined, and I know there were doctors with the company for about probably 15, 20 years that were involved in the panel. So it's really good to have that diversity when we're looking at new products and equipment that's kind of coming into the office, and which is really, really cool. Is guess what? So we're giving our input, we're giving our our experience with whatever we're looking at and whatever projects we're working with, and this is going to affect the network nationwide pretty much. So you really want to work hard for it. You really want to make sure that you're doing a good job kind of making these observations and any critiques and any experiences that you're having with them, because this is going to affect, hundreds of doctors, thousands of patients, and you really want to do a good job with it. I thought it was really fun to be part of. This year, I'm the university ambassador for Salus University, and I'm really excited because, I love Salus. I get back there every time I could. And honestly, when I was in the Philadelphia area, I was always stopping at the clinic typically and doing this anyway. So I think that might just have the title. It's something I've been doing for a while. But it's really about kind of spreading awareness and giving some insight. I think it's typically for the student body, but also, I go and I like to talk with the faculty as well. And they'll go, hey, Rob, great to see you again. So what are you doing now? And I kind of explain what I'm doing. I'm like, oh, really? So that's what you do. That's how your environment is. That's how you're working. Those are the type of patients you're seeing. Because guess what? No matter what, wherever you're at, you don't necessarily understand what's going on in the rest of the modalities, in the rest of the world, in the environment, in the optometric community. So it's really good to kind of speak with the faculty as well. And like I said, I'm not trying to bring some of the faculty over. I want them to continue to teach these great students all the knowledge that they have. If they want to, of course they can.
Sure.
But you know, when the student has a question, you know, they're going to go to the faculty and talk to them about all the clinical and you know, professional questions, as well as, you know, business, you know, their future as well. And it's nice that the faculty knows kind of what's going on and what, you know, Dr. Africano is doing this. So maybe if you want to contact him and talk to him about that. So I like to do that. But of course, you're spreading the, you know, the information to the student-based body and kind of letting them understand your environment, like I said, just like this, what patients we're seeing, and just kind of laying that out for them so they can kind of understand the world that I'm living in, and if that's something that they would be interested in.
Yeah. So, you know, it definitely sounds like you've had an opportunity to experience many different roles in addition to what you do on a daily basis. So, you know, definitely a lot of opportunities out there. And now I just want to get into it. This is probably something everyone, you know, really wants to know about are benefits, you know. So let's just talk benefits for a minute. You know, what's just the general overview of some of the common benefits you get, you know, because in reality, when you graduate and you find that first job, a lot of times you're being paid as a 1099 independent contractor. You have no health insurance. You have no vacation days. You have no retirement. I mean, I can tell you from experience. That's kind of how I started off, and that can get pretty scary pretty fast. Because I'll tell you, I mean, I've been paid all kinds of different ways. I've been paid production only. I've been paid per patient. I've been paid flat rates. And, you know, when you're out there and, you know, you're paid production, well, if your schedule falls apart, you know, an 8-hour, 10-hour day, you go home with $50 in your pocket. That can get scary pretty fast, especially when the student loans start knocking on your door. So, absolutely. You know, why don't you just tell us a little bit about that?
Certainly, absolutely. So you want exact numbers now?
Yeah, all the details. General things. We'll keep it general.
Sure. Okay. That's good. So, you know, one of the, like, going back to when we first talking, when that recruiter painted the picture, I was really surprised with kind of what they could offer. And obviously, they said you're going to have competitive and excellent compensation. You know, the thing about that compensation, just like you said, is it's guaranteed. You know, it doesn't matter how many patients you see. You know, there can be 2 or 20 on the schedule. You're going to be getting paid for that day. Granted, there are some incentives, and there is a bonus structure for if you're going to see a higher number of patients. So if you are seeing a little bit higher on that kind of that spectrum, you will be you will benefit from that as well. So you don't want to say, you know, if you're in a new practice and you're seeing 2 a day versus you're seeing, you know, more than that. You know, there are benefits on both sides. Of course, you want to stay busy. You know, kind of coming right out of school, you say, oh, I want that you know, new practice, kind of those low numbers. That gets boring really fast. Yeah, you know, definitely. You want to be moving. You want to keep your skills sharp, and you know, you want to continue to progress there. So it's really nice to have that guaranteed paycheck, you know, like biweekly. It's really nice to have the benefit structure, particularly actually, you know, one of the things, believe it or not, so, you know, I'm a younger guy, but one of the things we were looking at, my wife and I, was about the, you know, the between pregnancy and kind of what the insurances and the medical insurances be covering for the hospital stays and things along those lines. Yeah. You know, starting a job, you want to look at that, because that if you don't, that can end up really fast, and that can get you in trouble.
Oh, for sure.
Yeah, and you know, new grads, you know, typically you might be a little bit on the younger side. You know, things come up, and those, like I said, those bills can get high. So you want to make sure that the benefits are right for you, and the benefits were excellent. You know, between health and dental, of course. You know, there's with my practice, I have a simple IRA, so I can think about my future as well. That was one of the first things that my area doctor was discussed with me, kind of after I took the job. He goes, Robbie, you got to set this up. He goes, you're young now, but you know, those years pass by quickly, and you really want to be thinking about your future. So that's really nice that, you know, that's there for us. I'm trying to think about it. I probably had a list of stuff that I want to talk about. Oh, and of course, vacation time. You know, nice. Yeah, you know, vacation, and that was one of the things too. And you know, new to the private sector and the real world. I don't know, what to expect, but I'm like, that seems pretty good, and it's very competitive, or highly competitive considering what we're getting. And after your second year, which is after you complete your first year, be it a month or be it 12 months, that gets you pretty much at a very nice level, and you kind of move forward there, getting additional days with tenure. And it's great. And another thing about the vacation is, guess what? If I need to take off a Saturday or a week for a trip, it sounds silly that it's paid vacation, because I know in a lot of other professions you don't have to worry about that. But when you're a doctor, you do.
Yeah, you definitely do.
Yeah, Antonio, if you're in a private practice and you're gone, not only are you paying for the vacation, but you're also not getting paid for that time.
Yep.
That's scary. That's scary.
Even if you're working for someone, I mean, you take time off, it's unpaid time.
And it's actually I'm glad I'm talking about this, because one of the doctors I work with at my location, I think he was working with a sublease for a long time, and he hasn't been on vacations in years. And he goes, maybe I'd have a long weekend like twice a year, and I'm like, oh my, really? I'm like, oh my gosh. So you just. Yeah, exactly. A 3-day weekend. But he's a hardworking gentleman, though. So I know he, but so not everyone's like that, of course. But that's tough, and that's something to always consider and think about. That I can take a vacation. I don't have to worry about getting coverage. I don't have to worry about not getting paid. And there's just little things that you might not think about right out of school when you're not kind of considering it. But when you're actually out there living it, it is something that's very important. And it's important for your quality of life, because this is our job, and it's great. We're doing some amazing things for patients, but you want to make a comfortable living, and you want to still be able to enjoy life. You want to look at the big picture. You want to go home to your family, go home and do what you want to be able to do, and enjoy what you want to be able to enjoy without sacrificing too much for doing the great things that we are.
Yeah. What about in terms of continuing education? Any?
Oh my gosh, I'm so glad. I can't believe I didn't bring this up yet. Yeah. So another thing. So this, I think, was the icing on the cake. Was the CE program. So I know it's because it's right before my wife's birthday. So I'm horrible with dates, but I always remember this one. Birthday present lined up the month before, just in case I get backed up. So we have our CE meeting. And it's more than just a CE. So first of all, you can get 22 hours at the CE, and this is at no cost to the doctor. This is at expenses paid, so they will fly you to the CE event. They will pay for your room, so they'll pay for your hotel room, which is always very, very nice. Really high end. They always take pictures and show my wife, and she's coming. She says, I'm coming next year. She goes, you're not getting me not to come next year. I'm like, well, I want to be gone all day. And she's like, well, there's shopping and there's other things I can do and enjoy. There's the locales.
That's why she wants to come, right?
Yeah, now it's going to cost me something now. Yeah. But so it's a great event, and it's more than just the education. The 22 hours, which is a lot. From North Carolina, we need a little bit more than that, so I do a couple online classes, and I go to an event, and then I'm done for the year. And for a lot of people, they are done for the year with that, so that's awesome. The CE quality is great. This year's lectures were amazing, but it's also really a celebration. And it's really I didn't look at it initially like this, and I don't think they look at it, but I'm realizing it's a spectacle for the doctors, because it's just a celebration of what we do, how we do it, and it's just a thank you. It's more than just here's the CE. We have a big banquet dinner one of the nights, and they talk about all the tenured docs, the 5, 10, 15 plus year, 20-year docs, and they just really give their thanks for what we do year in and year out, for all the people that we help, and they really celebrate us, and which is nice to be in a company which is kind of doctor centric, because so a lot of times the dollar is going to be what guides you, and that's understandable. That's going to be a factor a lot, because to keep food on the table and keep the doors open, dollars are going to matter. But luckily, in the setting that we're in, we can really appreciate what we do and kind of optimize what we do, which is really nice.
Yeah. So just it sounds like you kind of entered this just with a really open mind, and you entered it to see you had nothing to lose, and here you are. Sounds like you're happy. Sounds like you have no intentions, of changing courses. And thanks for sharing all this with us, and for all of our listeners, and for everyone here.
And Tony, can I stop? I'm going to stop you just for a quick second because you just reminded me of something. Changing courses, and that's actually another big thing that I know a lot of my students would ask me, and new grads want to know, is about a non-compete. And typically within the National Vision Network of offices and the doctors, typically there isn't a non-compete clause in the contract, which I think is huge.
It is huge.
And for me, I was a new doc, and I was also in a new location. So I didn't know if I worked in this office, was I going to have to commute, 60 plus minutes somewhere else if I did have a non-compete. So that's something to think about as well. And I'm very strict with reading all the fine print, and I'm like, where's the non? I go, there can't be this package without a non-compete. And typically, a huge factor for me. So if this is something that you want to try, and like you're not sure that this is going to be the rest of your life, this is going to be a career, you do have that opportunity. And then you get in and you're like, I can certainly make a career out of this. And I think that's what you're kind of alluding to. That's what I just determined, that's what I discovered. But let's say it's not for you, and you want to have those opportunities elsewhere. You have the availability for that, which is really nice.
That's wonderful. Thank you for sharing that. I can't thank you enough for joining us. If anyone has any questions, even after the event here, you can email me, Antonio@covalentcareers.com, and I can get you in touch with Dr. Africano. But thanks for joining us, and we'll definitely have to do it again sometime soon.
Absolutely. I love it. Thank you so much for having me. Like I said, absolutely. I'd be happy to help with any other questions or answers that we can kind of supply for you there. Thank you so much.
All right. Have a good rest of the day.
Thank you. You as well.